بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Good afternoon to all fellow guests. Welcome to webinar session of the Higher Education Virtual Expo 2021. With me here is Dr. Hjh Norol Ehsan, Haji Abdul Hamid, who will be presenting Ministry of Health under Unit Health for Children and Young People. Senior Medical Officer. She will be talking about youth and health. Now, without further ado, I will pass to Puan Dr. Hjh Norol Ehsan.
Thank you very much, Tuan Hafiz. Okay. So without further ado, let me introduce myself. I'm Dr. Hjh Norol Ehsan binti Haji Abdul Hamid, a Senior Medical Officer in the Promotion Center. I'm also actually strategic lead holder for adolescent health strategy under the Ministry of Health Strategic Plan 2019-2023. Okay, so what I'll be presenting this afternoon will be about youth and health. Yeah. The reason I choose this topic is because I feel it's more relevant to you all because you are the youth population of the country. Yeah. So and also so I want to share what's the importance of health to your to you all. Okay. So let's start. Present this one. Okay, let's start with the definition. What is youth? Youth by WHO, World Health Organization, young people aged 10 to 24 years old. So, and then that, and they define adolescent as those 10 to 19 years old. And United Nations also define youth as or those youth aged 15 to 24 years old. Okay, so however, in Grand Darussalam context, according to the Grand Darussalam Dasar Belia Negara Strategic dan Strategi set up by the Ministry of Culture, Youth and Sports, they define youth as 15 to 35 years old, or we call them you all belia lah, huh? Okay. So what about definition of health? Health is a status of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmity. And actually, as long as they are able to lead a socially and economically productive life. So meaning macam kalau sekiranya a person itu ada ampusa, bukannya mestinya iaitu sakit. Ya kena bagi ubatkan to apa ni, to for the treatment of the ampus and then for prevention apa kan, but the person also still sihat because he or she can still lead a socially and economically productive life. Okay. So there are different aspects of health, yeah, like wellness, sleep, okay, nutrition, movement, general health, and mental energy and motivation. However, I would like to touch on some of the issues here lah, okay, because of the time constraint, yeah. Okay, so first I would like to discuss with you why is health important to you all. one, they are important in three aspects of life. Okay, like kamu you have this exciting part of your life of your journey kan, and then you are physically, emotionally and intellectually apa tu, the changes in the apa ni happening in the daily life. Okay, and then so 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 health is very important for you all, for you to become healthy, okay, and for you to able to do whatever you want to do in your life lah, in particular like macam study apa tu kan, and then also the other benefit is another one is to lead as a healthy adult in the future. So example, if you continue to stay healthy and then stay practice healthy aging, inshallah you will be like macam orang panjang umur. And then also thirdly, another one is you can be as a role model to the future generation. Okay, masa when you get married apa, and then you can also practice healthy lifestyle for your family. Okay, so there are many factors of health. Okay, this chart here shows the different factors of health, which it varies. One, age can be a factor of health, like the gender. Okay, and then the individual behavior. Okay, and then also links to the social and community works, and also as a whole, affected by the general social, socio-economic, cultural, and environmental condition of where you are. Example, in the living or working conditions, or example, with regards to education, yeah, ataupun including also water and sanitation, yeah. Okay, so so what I want to touch here about is going to focus here on the individual lifestyle, of which is more linked to your behavior. Okay, so your behavior can also affects the health, your health. Yeah. Okay, so let's talk about behavior. Okay, behavior behavior pattern started from the child and adolescence. Okay, and it can stay and usually go through to the your apa tu namanya, masa masih muda, and then up to your adulthood life. Okay, and it can apa namanya, it can like persist lah until your adult life, which many factors can also apa ni comes into it lah, like modify your behavior and things like that. Okay, so with regards to your behavior, it links to the health issues. Okay, so what are the health issues among youth? Okay, these are only some of the health issues. Example, injuries, violence, mental health. Okay, drug and alcohol abuse, tobacco use, sexual transmitted infection, and unintended pregnancy, undernutrition and obesity, and physical activity. Okay, I'm going to touch some of the topics here. Okay, and then I'm just going to start with some evidence first. Okay, of which I'm going to share with you some data. This data is about the prevalence, meaning the percentage of non-NCD. NCD is what? NCD is non-communicable diseases. Okay, NCD risk factors. Yeah. So this bar chart shows the different percentages of NCD risk factors among the participants in the survey. There are two surveys conducted. The NHANNS, meaning stands for National Health and Nutritional Status Survey 2011, and also STAPS Survey 2016. Okay. So in this survey, it reveals that when we compare the two surveys, in general, there's a slight increase in the risk factors, and in particular the obesity and overweight, and also the hypercholesterolemia. Hypercholesterolemia meaning high cholesterol in blood. Okay. And what is striking features here is that there's nearly all of the participants do not take adequate fruit and vegetables. Yeah, okay. And then other risk factors including hypertension and diabetes, which in this case it shows it has a decrease in the Tulaha percentage of those having hypertension and diabetes. So and then another data here about physical inactivity. I think this is also part of the STEPS survey. Yeah. Which shows a decrease in physical inactivity, meaning more of the youth population, you guys are more active lah, ha? Okay, as you can also see, like I would say back in 10 years now, more young people are getting more active physically. Okay. Okay. So what affects all these risk factors? This is actually one of the factor is actually nutrition. Okay, apart from the physical activity. This is a national dietary guideline for Darussalam, which is a revised national dietary guideline by Ministry of Health, and it contains 8 recommendations. One, need to drink plenty of water. It is advisable to drink at least 8 glasses of water per day. Okay. And secondly, eat 2 servings of fruits and 2 servings of vegetables every day. Okay. And then third, consume milk, yogurt, cheese, and alternative, preferably reduced fat. Okay. And then reduce the intake of energy dense food, sugars, drinks, and salted foods. Okay. Energy dense food meaning food um, that can produce energy for you to do all your activities. Okay, but if you eat too much, or the way you eat too much, okay, it will be stored as fats. Okay, and also on top of that, if you don't do physical activity, the excess energy will be stored as fat as well. Okay, so the fifth recommendation is use recommended cooking oil sparingly. And we also would like to highlight that practice itulah grill or steam foods as compared to frying foods. Okay, and then the sixth combination is eat fish, poultry, lean meat, legumes, and other protein in moderation. And then base meals on grains with at least half of the grains whole grains. Okay. And last, enjoy a widely variety of nutritious food within the recommended amount. And then on top of this, Ministry of Health also has endorsed Healthy Choice logo, but I think it's about 5 years now, yeah. And you can see this logo on packets of food and beverages, majoritinya yang local ones, okay. And also, so whenever you go for grocery shopping, make practice to look for this Healthy Choice logo, okay. And also, other packages from other countries also have their own Healthy Choice logo. Okay, example from Singapore, Australia, Thailand, okay, and Malaysia. Okay, so you can also look for all these healthy logos when you go for grocery shopping. Next, we look at the physical activity. Okay, physical activity, the version recommended for physical activity is to do at least 150 minutes of moderate intensity physical activity throughout the week. What does it mean by moderate intensity physical activity? Meaningnya selagi apa tu yang kamu dapat boleh bercakap semasa kamu membuat the physical activity, okay? Or you can do at least 75 minutes of vigorous intensity. Ini kalau yang sudah steady lah, physical activity throughout the week, or an equivalent combination of moderate to vigorous intensity activities. Okay. Next, I want to touch about tobacco use. Okay, here is the data on tobacco use among adults aged 15 years and above, and also young people. Of which here, as you can see, the current tobacco smokers from 3 surveys, in fact, the enhanced survey, the tobacco qualitative survey, and the step survey show nearly about 20% of the smoke of the young people and adults are smokers. Okay, and when you look at the male and the female prevalence, you can see apa tu, male is like more than, it's like 10 times that of the rate of the females, okay, smoking, okay. Although there's still a high prevalence of smoking in Jerusalem, despite the enactment of our tobacco control order, which was out in 2005 and enacted in 2008. The current main challenges that we're facing adalah illicit cigarettes that coming in, cigarettes vape coming into the country. Okay, and alhamdulillah, like all the shops and convenience stores do not sell cigarettes anymore. Because as they follow the regulation in the tobacco control order. Okay. This is the most recent data. Just want to share with you, among those aged 13 to 15 years old, recently the Global Tobacco Survey, GYTS, was done in 2019, which reveals that actually when you look at the blue bars, the overall 8.4 is actually less than the previous data. Okay, but however, when you compare with those taking e-cigarette, it is higher than those smoking tobacco. So meaning e-cigarette is another a big challenge for us lah to curb this issue. Okay, because at the end of the day, it's also tobacco. Okay, so it's also part of the policy in the tobacco control order. Yeah. So let's talk about more about the electronic cigarettes. Okay. These e-cigarettes, including vape, is one of the kind of tobacco product. Okay, and it does not replace cigarettes like some people claims lah. And then it also contains nicotine as well. Okay, yang kita tagih tu. And also some of it contains chemicals, similar chemicals as in the cigarettes lah, which can cause cancer and eye and throat irritation. Okay, same consequences as for cigarettes. Okay, and so it comes in various forms and sizes. So the issue with the current electronic cigarette is that, as I said just now, people thought it's a way to quit smoking, but actually it is not, because it's never been assessed or it's never made approved by any regulatory agencies globally that it can replace cigarette. And also there's no scientific evidence that it is effective to help in a smoker to quit smoking. Okay. Now we look at the effect of the tobacco product. Tobacco product maksudnya any tobacco product termasuklah cigarette, vape kah ataupun cerut kah, whatever lah. Okay. So the effects are, one, it can cause lung cancer, halitosis, meaning halitosis macam berbau bad breath. okay, berbau nafasnya, okay, because of the all these chemicals and the contents of the vape ataupun cigarette itu. And then strokes, gangrene, and erectile dysfunction. Why? Because the content of cigarette itu kan, it is deposited when it goes into your body. When after you smoke, it goes into your body and then goes into your blood vessel, and it's deposited on the walls of blood vessels. Then becomes apa namanya, make the lumen of the blood vessels smaller, so that it will hinder the passage of the blood to the distant organ itulah. So it cause stroke, and gangrene maksudnya the death of the tissue, okay. And then erectile dysfunction maksudnya mati pucuk, okay. Other other effects including mouth cancer, cancer of the uterus atau peranakan, and then cancer of the neck. Now, what about passive smoker? Okay, those are for the active smoker lah. Ini passive smoker yang bersikup. Okay, tetapi they are exposed to tobacco smoke. Okay, in the surrounding area. Okay, maybe example apa ni, dalam rumah ke, okay, from husband ke apa yang bersikap macam tu. Okay. So for this passive smoker ni, they actually have a much higher risk of getting consequences of tobacco use, including the health effects. So withdrawal sebenarnya lagi bahaya risiko mendapatkan all these consequences as compared to the active smoker. Okay. And there are 3 times more tar in the nicotine, and also 5 times more carbon monoxide in the atmosphere in the air itulah, and 50 times more of the cancer causing chemical agents. Yeah. So this leads to 30% more risk of getting ischemic heart disease, maksudnya penyakit jantung. And also for the female passive smokers who never smoke tapi live in a smoke environment with a smoker, okay, they have a 24% higher more risk of getting lung cancer. Kan? And now looking at the kalau sekiranya pregnant women, it can affect the babies as well in their uterus. Okay, example premature delivery, maksudnya awal lahir, okay, belum cukup bulan, and then miscarriage, keguguran, or kematian dalam umurnya setahun, right? And now, why is it hard for people to quit smoking? It's just because of the nicotine content in the cigarette ataupun in the vape, okay, ataupun electronic cigarette. This nicotine cause addiction. How? When someone smoke, okay, the nicotine inside the cigarette will reach the brain sekejap saja, within 10 seconds, less than 10 seconds, and then it stimulates the cells, and then forming producing neurotransmitter, the cells in the brain, okay, they call it dopamine. They form they produce this dopamine, and this dopamine then makes the person to feel calm, and also makes the person to feel act as a stimulant lah, supaya macam semangat ke apa, macam apa ni, segar lah situ lah, okay, alert lah situ. And then when the dopamine level getting less, okay, so the smoker tu will start to feel restless dia punya rasa dia apa, and then not feeling calm. And so this makes the person look for the nicotine, which is the cigarette, and then smoke it again and continuously feeling calm. That's how nicotine makes the smoker to be addicted, okay, to smoking. Okay, so we advise for those smokers to try your best to quit smoking, and for those who haven't smoked, to not to start smoking lah. Okay, so there's a benefit for stop smoking even within 24 hours. Okay, if you quit smoking within 24 hours, it can increase the level of oxygen to the blood. Okay, and so meaning your organs can also function better lah. Okay, and then carbon monoxide and nicotine is removed from the body. Okay, and then within 2 days, your sense of your sense of taste and smell tu ada recover macam pulih lah daripada sebelumnya. And then within 6 months, you'll be having less cough and producing sputum, having less producing sputum itu, and then also the lung begins to recover to normal cells, and then after a year, there's a less risk of getting heart attack, and then 10 to 15 years also less risk of getting lung cancer and also stroke. Okay, so we advise for those who like to quit smoking, to go to the nearest health centers. It's all available in the all government health centers, and where we provide 6 months of smoking cessation counseling program. Okay, and you can actually just walk in ataupun minta refer from your private doctor lah, example lah. Okay, now let's move to mental health. Here I would like to focus on stress. Okay, what is stress? Stress is a state of tension that arises when you experience demands from your environment or from within yourself. Okay, it can be real or perceived threat. It is normal. It is actually a normal physical response to events that exceeds one's ability to cope. Okay, so it's not abnormal. Kalau sebenarnya normal lah. The matter is how you can manage the stress. Okay, so example, kalau sekiranya dalam in your life, for example, ada changes, example, kan moving from secondary school to a tertiary level, so I'm sure you come across, you experience some level of stress. Okay. So this stress is actually normal, as I said, and it is and then our body are designed to handle stress actually, and it's actually one of the kirakan tool lah for basic survival lah. Okay, how by engaging a fight ataupun we run lah for our life okay. So kalau masa when we fight, example we react to the stress tu macam tu some demand tu chemicals ataupun like example adrenaline in the body will be secreted, okay, and then this will then cause certain changes to macam example make your heart heart pumping faster, breathing faster, okay, and then become more alert, okay, example lah, and then your blood sugar raise because sugar is a form of energy. So as a fuel lah, it's a fuel to supply energy to whatever action you want to take lah lepas masa stress tu lah, okay, and then tapinya how much stress do we need? Yeah, okay. We do need stress, tapi macam mana tu? Semestinya stress satu, well, depends on a person's life lah. Kalau sekiranya macam the experience stress satu, meaning atau adang normal pulang tapi then the person have to try to manage it well, okay. Okay. So if sekiranya too much stress, meaning it can cause bad effects to the body. Okay. Example, increase the blood pressure okay, ataupun headache, okay. If and then last getting depression, anxiety, and then sometimes kadang-kadang too much stress and then can't cope it, involved in drug abuse and things like that lah, okay. So how can you do to prevent from this happening? Meaning how can we do how can we manage stress well lah, okay, so that it doesn't kind of like overcome our ability to handle it. We need to change our perception of life, okay, by ABC. Okay, A meaning antecedent, example, be prepared for what will happen apa nama, in any event. Okay, example, you're driving in a busy highway and then someone cuts right in front of you, then it slows down. Okay, so that's macam gerakan expected lah tu gerakan. So what's next? So what's your response? It can be either diteriaki, dimarahi orang itu, dapat itu cakap stupid ke apa, ataupun become marah macam irritated masa driving itu, ataupun you think positively saying that oh barangkali ia berabut kali kan, maybe yang dia pay attention kali kan, so maybe kita ni pun pay attention, then we do mistakes as well. So like macam itulah macam example macam Quran surah macam tu. And then see two things can happen, the consequencesnya. One is either kalau sekarang yang marah tu kan, so it's either initiated by fight ataupun fight or flight response lah, macam as I mentioned tadi, blood pressure pun naik apa, and then become more alert, and then breathing rate will increase apa, macam naik marah ataupun ada option you stop the stress response before it even starts. So meaning you control the stress itu. So okay. So example macam tadi, if you think positively like this one, have positive perception, then you will be able to stop to manage the stress. Okay. Other ways are make a practice to think positively, and then regular exercises, because exercise can boost endorphin, which actually puts the people in better mood, and then reduce our anger and gives more energy and improve our mental awareness. And then of course, eat healthily. Okay, practice healthy diet, well-balanced diet, and breathe, deep breathing, meaning for enough supply of oxygen to the cells. Okay, and also you can share and speak up to whoever you trust lah. Okay, not plan with somebody you don't trust. Okay, you still someone that you trust. Okay, if you're interested and you cannot manage it well, ataupun juga you can go and seek for professional support in many health centers ataupun your GPs. Okay. So I think my presentation is coming to an end. My take-home message is only one plank saja sebenarnya. Basically, be a responsible person. Why? Because one, you are becoming future backbone of the country. Okay, so that's my responsibility there. And then also juga kita ni dijadikan Allah Ta'ala, and then kita ni diamanahkan untuk menjaga diri sendiri dan keluarga dan negara kita ni lah. And so how kita ni menjaga diri sendiri is by practicing, one of the ways is by practicing healthy lifestyle, and also encourage your loved ones ataupun your friends to practice healthy lifestyle. Ataupun like example lah, bawa apa namanya, beriadah kah, okay. And then kalaupun macam menjemput majlis apa, try your best to serve healthier plate, okay, healthier menu, okay. And then another thing to become responsible, macam kalau sekiranya, okay, example in a situation where example macam tentulah kira tengah terbalik ke apa kan, and you are stressed, and then you have to be responsible to manage it well. Okay, let me see if I miss out anything. I think that's all. So if you have any further queries, you can also reach us at the contact number stated in the screen, and you can also visit our Instagram and Facebook and our website, and also drop us an email at hpcbrunei@moh.gov.bn. Thank you very much.
Okay, thank you very much, Dr. Hjh Norol Ehsan. Now we will be going to the question and answer session. Uh, there's one question from Ms. Allen Ho. She asks, to have a healthy diet, can we follow the healthy plate? That is, half of plate is vegetable and fruits, quarter is carbohydrates, and quarter is protein.
Yes. Yes, that's actually recommended by Ministry of Health. It's a healthy plate where half is vegetables and then a quarter carbohydrate and the other quarter protein, any kinds of protein. Huh? Um, Many people, I'm sure some people lah tu lah, like some particular vegetable, and then especially for the kids kan, you try to encourage them to take vegetable, enough vegetable, okay, whatever kinds of vegetables that they like lah, yeah, okay. And then also another point, for the healthy plate, macam the dish satu, is the way you prepare pun juga is satu. It's so important. Example, like the protein kan, chicken or beef or fish, ya. Kalau bergoreng with rice, nak payah setiap hari. Okay, kalau boleh lah, sebenarnya once a week. Okay, and then menggoreng itu, the kind of oil sebenarnya is actually to be safe, kita ni pakai pelang minyak cap buruh. Yes, memang minyak cap buruh itu tinggi in saturated fat, tetapi the reason is that why we cannot use unsaturated fat, because like example kalau macam canola oil ataupun sunflower oil, if we use it for cooking, it will be exposed to very high temperature, and then the chemicals ataupun the compounds in the oil itu kan, it will be changed to trans fat pelang tu sebenarnya, if it's exposed, if it's heated up in very high temperature, example masa frying. So ideally kalau kan frying, pakai itulah saturated fat, of which because the fat components are more stable in higher temperatures, but no need to fry every day lah, dok. Macam tu. Okay.
Thank you very much, Dr. Hjh Norol Ehsan. And there's another question from Daniel Zainal. He's been asking just to clarify regarding the NDG revised in 2020. Would this replace the suku-suku setengah formula?
The suku-suku setengah, do you mean the plate portion kali tu? Suku-suku setengah tu. Because suku-suku is on quarter and setengah. It's still the same. It's still the same. But in more details ada in the actual document. But that's the brief recommendation pulang. Yeah, but we still we still stick to that suku-suku setengah je lah, as was what was us from the previous audience tadi.
So
Before I end this session, okay, my last session is for the youth ataupun these young persons, since again, since you are the the important assets of the country, okay, and as an important future background of the country. So it's very important that you take care of your health, okay, and be responsible, okay, for your health and also on your family, so that our country can become prosperous, and also be prosperous prosperous with citizens practicing healthy lifestyle and also become more productive citizens for our country.
Okay, I think that is all. So thank you very much to all participants, and thank you to Dr. Hjh Norol Ehsan. Now we will conclude. We will end the session. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.